contour of the head, looking for any deformities. The head is normal cephalic with no deformities. I am palpating the head. Any tenderness or pain?
No.
No tenderness or pain, no obvious deformities. I'm palpating the texture of the hair. It's smooth, the condition's good. Looking for any infestations. No infestations, the scalp is shiny and smooth. Now inspecting the general condition of the face. Symmetrical at rest and with movement. Can you smile and frown?
I frown.
Good. Face is symmetrical with movement. I'm now going to palpate the temporomandibular joint. So if you could open, close, open, close. No crepitus noted. And then if you can clench down for me. Cranial nerve 5 is intact. I'm going to have you close your eyes. And if you could tell me when you feel something cross your face. The sensory of cranial nerve 7 is intact. I'm now going to have you, again, smile, frown, puff out your cheeks, show your teeth, whistle, if you can. Good. The motor of sensory nerve 7 is intact. I'm now going to place something on your tongue, and if you can tell me if it's salty or sweet.
Salty.
Good. The sensory nerve of cranial nerve 7 is intact. I'm now going to inspect the eyes. The eyebrows and eyelashes are evenly distributed and symmetrical. I am going to inspect the lacrimal apparatus. No inflammation or drainage. I am going to inspect, just look forward for me. Bright light from the side. The color is hazel. The pupils are equal symmetrically. The lens and cornea are transparent with no opacities. I am going to inspect the conjunctiva and the sclera. Conjunctiva is pink and sclera is white. We're now going to do some vision tests. So I'm going to have you stand up, cover one eye, and I'm going to have you read the lowest line on that chart for me.
E, C, D, F, Y.
Good. And the other?
E, C, D, F, Y.
Good. Cranial nerve 2 is intact. You can have a seat with the Snellen. I'm now going to have you cover one eye, any eye you like, and I'm going to have you take this postcard and read the lowest line for me. Just hold it closer. We're testing your vision up close.
Twilight eclipse.
Good. Okay, and we're going to do the same in the other eye.
Twilight eclipse.
Good. Vision with binocular is intact. I'm now going to have you follow my pen light. Try not to move your head, just look directly at my pen light. Okay. Good. No extraocular eye movements or nystagmus noted. I'm going to have you look straight ahead, and there's going to be a bright light by your nose. Good. Corneal light reflex is intact, symmetrical with no strabismus. I'm now going to test your peripheral vision. So if you can tell me if you see both of my hands at the same time. If you see the left first, stay left. If you see the right first, stay right. Okay? Okay. Visual fields by confrontation are intact. We're now going to do the cover-uncover test. So I'm going to cover one eye. Good. Cover, uncover without deviation. Okay, another bright light if you could just look forward for me. to light and accommodate. They're about 2 millimeters in size bilaterally. I'm now going to take my ophthalmoscope and inspect the internal structures of the eye. The disc margins are sharp and vasculature is normal. Cranial nerve 2 with the Snellen and the binocular vision is intact. Cranial nerve 3, 4, and 5 with the vision tests are intact. We're now going to inspect the ears. The ears are normal in size bilaterally. They align with the outer canthus of the eye. The color matches the color on the face. Any pain or tenderness here? Pain or tenderness? No pain, tenderness, masses when palpating the external ear. I'm now going to inspect the external auditory canal. Both external auditory canals are pink with cerumen present. No drainage or lesions seen. I'm now going to take my otoscope and examine the tympanic membrane. They both are pearly gray, mobile, with all landmarks visible. I'm now going to perform some hearing tests. I'm going to stand behind you and cover one ear and ask you to repeat the 3 words that I say. Baby, giant, baseball.
Baby, giant, baseball.
Little, 7, car.
Little 7 car.
Good. Hearing via the whisper test is intact. Okay, I'm now going to put this on your head and I need you to tell me if you can hear it in both ears or one or the other.
Both ears.
Okay, good. And then I'm going to do it and I'm going to put this behind this ear and I need you to tell me when this sound stops. And can you still hear it here?
Yes.
Okay, air conduction is greater than bone conduction via the Rinne test. Cranial nerves 8 are intact. I am now going to inspect the nose. The skin on the nose appears intact. There's no lesions. It's midline. No drainage noted. I'm going to palpate the external nose. Any tenderness?
No.
No tenderness noted. I'm going to test the patency of the nares. I'm going to cover up one nostril if you could breathe in. Good. Nares are patent. I'm going to inspect the internal structures of the nose. If you could tip your head back. The septum is midline without perforations. The mucosa is pink and moist. I'm now going to have you, I'm going to test cranial nerve 1 by asking you to smell something. So if you could close your eyes. Tell me what this smell is.
Something sweet. Flower.
Good. Cranial nerve 1 is intact. I'm now going to assess the mouth. The lips are symmetrical, no cracks or lesions. I'm going to put on my gloves because we're going to assess the inside of your mouth.
Sweet.
Mucosa and gums are pink and moist. Presence of saliva is appropriate. The breath is fresh. I'm going to have you open your mouth and put your tongue to the roof. Good. The frenulum is intact. The floor of the mouth has no lesions. I'm going to inspect. Open your mouth for me. The teeth. The teeth are in good repair. No dentures, crowns, implants, bridges. 32 teeth present. I'm going to inspect the soft palate and hard palate. So if you could open. Soft palate and hard palate are pink without any lesions. I'm going to have you open again because I'm going to inspect the tonsils and the pharynx. plus. Pharynx is pink with no lesions. I'm going to have you stick out your tongue. Tongue is midline with no lesions. And can I have you move it side to side? Cranial nerve 11, the hypoglossal, is intact. I'm sorry, cranial nerve 12. I'm now going to have you open your mouth and say ah.
Ah.
The uvula moves up, so cranial nerve 10 is intact. And I'm going to have you take this glass of water and swallow for me. Cranial nerve 9 is intact. I'm now assessing the neck. The neck is midline with no swelling or deformities. I am going to palpate the trachea is midline. I'm now going to palpate your thyroid. So if you could put your chin to your chest and then turn your head slightly to the right. Any tenderness or pain?
No.
Okay, and turn your head to the left. Any tenderness or pain?
No.
So the thyroid is non-tender with no enlargements or masses. I'm now going to palpate your lymph nodes. Let me know if you feel any tenderness. Preauricular, postauricular, occipital, submental, submandibular, thyroid, anterior cervical, posterior cervical, supraclavicular, and infraclavicular. I'm going to test, the nodes were non-palpable. I'm going to test your range of motion, so if you could put your chin to your chest, up to the ceiling, look to the left, and look to the right. And I'm going to have you look forward now, and I'm going to have you turn your face against my hand. Good. And on this side. And then I'm going to have you shrug your shoulders to resistance. Good. So resistance, range of motion with and without resistance is intact.